Good evening, everyone. I'm Penny Wyatt from the Office of Parent Programs, and I welcome you to our first webinar of our 2015-2016 season. I'm glad that you're here with us. I want to give you just a few reminders about how we implement webinars and how we'll facilitate that tonight, and then we'll start on this presentation, which is about campus health at Tulane. So I want to just make sure that you know that this is the volume that we'll be using for the webinar. So if you need to adjust the volume, you can do that on your computer. So you can do that on your end. I would ask, just so that we can kind of get an idea that everything is working okay, you can use the raise your hand function just to let us know that you can hear us. So I see some hands going up, so that's good. Okay, well, good. So you are muted. You won't be talking with us, but you can submit questions online, so you can write those in. But we do ask that you hold your questions until the end of the presentation. We find that we've usually anticipated all of your questions, but if you do have something that you still need to ask at the end, then we'll go through those and get through as many as we can at the end. Another thing that we do just to help you out is that we will send you this presentation, the slides for the presentation tomorrow. So give some time tomorrow morning, probably be tomorrow afternoon, and we'll email this to everyone. But we will also post the recording of the webinar on the Parent Programs website, and that'll be sometime next week. So there will be a link to the combined audio-video recording, and that will be on our website at parents.tulane.edu. You'll navigate to the webinars tab and just look under the archive of webinars and you'll be able to find it there. And we do that for all of our webinars, so in the future if there's one that you miss or you can't make it home in time or something to tune in live, then you'll know that a few days after the broadcast date you can find the recording there. So I also just want to mention that if you have other questions, there will be information on the last slide about how to contact the presenters, but you can also email me at parents@tulane.edu, and I can forward your questions on. I also like to get any suggestions you might have about the webinar or any feedback or suggestions for other topics that we might offer, so keep that in mind. So I want to introduce the presenters for tonight. So we have a representative from each of the 3 areas of campus health. So for the WELL, which is our Center for Wellness and Health Promotion, we'll have Maeghan Livaccari, who is a licensed clinical social worker, and she is the Associate Director of Wellness Services. And then we will have representing CAPS, which is our Counseling and Psychological Services, Dr. Rosette Elghossain, who is a clinical psychology postdoctoral fellow here with us. And then finally, the last section will be about the Student Health Center. And Deanie Stoulig, who is a registered nurse, she's the nurse manager at the Student Health, and she will represent that area and give that part of the presentation. So we do ask that you wait until you've heard all 3 parts, and then we'll start taking questions. So I would like to go ahead and turn things over to Maeghan.
Thank you, Penny. Good evening, everyone. We're happy to have this opportunity to speak with you this evening. We know from the literature that the role parents and guardians play in their students' life will directly impact their well-being even during college. This is a transitional period for both you and your student, and we would like to do what we can to help with that transition. Your student will continue to look to you as a trusted source of health and wellness information and care, so we want to make sure you understand the resources available here at Tulane in order to guide them as needed. You are a big part of their safety net and support network and will continue to be throughout the college years. This is today's agenda. We'll talk about the impact of health and wellness on your students' academic success. We'll talk to you about programs and services offered by the WELL, the counseling and psychological services, and then the Student Health Center. So there's plenty of information that we'll be speaking about today, but no worries if you miss anything. You can always check our website for more information, including descriptions of services, policies, conduct information, and a link to our online student patient portal. The student patient portal allows you to upload immunization forms and any other pertinent health information. And you can visit, once you get to our website, wavehealth.tulane.edu, it will be very clear that portal button will be right on the home screen for you. We'll also be having a session during move-in weekend, so look on that on the calendar when you get here. The overall theme of this evening's presentation is we at Campus Health prioritize your students' health and well-being. We recognize that none of these dimensions exist in a vacuum and they're all interconnected. We know your students' physical and mental health impact their well-being and overall experience here at Tulane. Providing comprehensive health services helps us contribute to your students' overall success. We pride ourselves on being inclusive of all students, regardless of race, gender, identity, sexual orientation, or previous or current health challenges. At Campus Health, we're dedicated to using evidence-informed practices. We regularly collect data on students in order to monitor the needs of our students and drive our services. This is the data from the 2014 National College Health Assessment. For this survey, we pulled a random sample of students and surveyed them about their health, attitudes, and behaviors. What you're looking at here are the responses from first-year students to the questions that ask them about impediments to academic performance. This data is consistent from year to year for our first-year students. So we make sure that we have plenty of services and programming and outreach and education that focus specifically on the top impediments listed here. Now I'm going to talk a little bit more specifically about the WELL. This is our staff at the Center for Wellness and Health Promotion, known on campus as the WELL. And our role is helping your students stay healthy and well at Tulane. The majority of our staff are certified health education specialists, as well as most hold a master level degree. The Center for Wellness and Health Promotion is the public health arm of Campus Health. Our education and prevention efforts aim to empower students to live healthy lives. We provide a wide range of well-being resources, programs, and services. Overall, our focus is on the prevention of harm and the promotion of health and well-being. At the WELL, we focus on 5 health content areas, providing services and programming to creatively and comprehensively address each issue. To address substance abuse prevention, we offer brief alcohol screening and intervention for college students, or BASICS. For this program, students meet one-on-one with a certified health education specialist to explore the role alcohol is playing in their lives and strategize ways to reduce risk. So I also want to let you know that the majority of our students each year of referrals to BASICS are first-year students. So I really encourage you to speak with your student about, have the conversation about alcohol and what your expectations are regarding their alcohol use. One of our most well-known sexual health promotion services is Get Yourself Tested, or GYT, program which offers free HIV and STI testing every Friday at the Student Health Center. We promote mental health through a range of programs that address issues such as resiliency, stress reduction, and healthy sleeping habits. We are also steadfastly working to reduce stigma around help-seeking behaviors, and we are training students how to identify warning signs for suicide. Your students will take part in such training when they complete the Cognito at Risk online program, which I'll speak about in a minute. If your student would like to quit tobacco, they can meet with a health educator to coach them through the process. We also provide nicotine replacement therapy when appropriate. In regards to power-based personal violence prevention, one wave is our Community Mobilization and Bystander Intervention Program. It is considered a best practice for institutions of higher education to provide bystander intervention training, and we've worked very hard in collaboration with many campus partners to have this available at Tulane. I've talked a little bit about the health topics we focus on. I'd like to talk now about the approaches we use to address these health topics. A lot of our work goes into addressing health and wellness at the population level to ensure that all students have access to quality health promotion resources. One example of this is that all Tulane students are required to complete My Student Body and Cognito at Risk online trainings. This ensures that all students have the same baseline knowledge about alcohol, power-based personal violence, and helping a friend in psychological distress. The deadline to complete these online trainings is August 17th. Students will receive instructions soon on how to access both courses, as well as the instructions are posted online at wavehealth.tulane.edu. You as a parent also have the opportunity to complete the parent course of My Student Body, which will allow your insight into what your student is learning. As I mentioned before, please have a conversation about alcohol and your expectations regarding your student's use. Even while your student is at college, you can have a profound impact on their decisions and behavior. Before arrival to campus, please have a conversation with your student about academic, behavioral, and social expectations. Ask your student about their expectations of alcohol and discuss the risks and consequences associated with alcohol misuse and abuse. Stay in close contact with the first-year student, especially during the first 6 weeks of the semester. The first 6 weeks of the semester are very important to academic success and is also a time period where students may begin to experiment with alcohol and drink heavily. Through these programs, as well as through individual consultations and small workshops, we strive to build the skills and competence necessary for our students to be able to maintain their health. We also provide brief intervention and education to help reduce risk and promote and support healthy behaviors. Finally, we are extremely active in supporting and developing our students as future leaders in health promotion and collaborate regularly with our campus leaders to ensure that collectively we are communicating and demonstrating a community of care and concern. We are a student-centered department, so it's critical that we engage them in our work. Using students to talk with other students about health topics has repeatedly been shown in the literature as a best practice. Our peer educators go through a credentialing process to ensure they are knowledgeable, effective, and following best practices in peer health education. We currently have a group of about 40 peer educators. The peer educators help with planning and implementation of events, provide education in our residence halls, and some work at our front desk. If your student is interested in getting involved in a health-related leadership opportunity, we encourage you to tell them about the WELL. Now I'm going to pass it over to Rosette from Counseling and Psychological Services.
So give us just a second to get set up here. We're broadcasting to you from a small office. So hang on just a second. Thanks, Megan. Hi, everyone. I'm also really excited to be here to talk to you tonight a little bit about the mental health services that we offer to Tulane students, both undergraduate and graduate. This picture right here is a photo of our main uptown campus location. We're in building number 14. So the building we're in right now is essentially the student union, and it's a very central building to the whole campus, and Counseling and Psychological Services, or CAPS, is just a 3-minute walk from there. So it's pretty easy to find. And we also have staff in the student health locations, both uptown and downtown. So our multidisciplinary team comprises licensed and highly trained social workers, counselors, psychologists, and psychiatrists. We all have particular interest in and dedication to supporting university students with a variety of presenting issues. So I would encourage you to let your student know that there's no issue too small or too large for them to come in and just ask for a little bit of support. So we operate through a consultation model, and what that typically means is when a student comes in to see us, one of our counselors or clinicians will conduct a consultation, which is about 20 to 30 minutes, thoroughly assess their concerns, determine what services might best fit their needs. And we have a wide variety of service options. One option is that they might decide that the student begin short-term individual therapy in our clinic. We offer up to 12 sessions of therapy per academic year, but we found that in many cases we're able to address the students' concerns with fewer sessions than that. We also have a wide variety of groups, and we're revamping our entire program. We have a sexual assault support group, adverse gender identity group, grief and loss support group, and we're adding a bunch more programming coming up in the fall. In some cases, an evaluation by one of our psychiatrists might be appropriate, and they can help work with medication management, things like that. In terms of referrals to community providers, we might determine that your student is a better fit for longer-term services, especially if they have an existing mental health concern. And in the email I think that Penny will send out tomorrow will include a how-to guide essentially for how to secure a community provider before your student gets here. So if you already have concerns, it's not a bad idea to look at that document and see if there are any things that, like they'll be a good fit for your student. And you're welcome to call us with any questions. We have a care coordinator on staff who'd be happy to assist you. I think the most important thing to know is that whether or not your student has ever been seen at CAPS, whether or not they're being seen at that moment or by someone off campus, they're always eligible and welcome to come in for walk-in services. So anytime that we're open, 8:30 to 5, Monday through Friday, there are clinicians on call to help support your student if they're experiencing something urgent. And we also just secured a contract, a 24/7 hotline that's available to students anytime, no matter what their concern is. I'm also our outreach coordinator, and so we offer psychoeducation workshops, presentations, webinars to all our students, and we're working on building a lot more programming for this upcoming year as well. As I mentioned before, it's pretty common now for students to come into college with existing mental health needs that they've either been addressing in high school or are currently concerned about. And most of those cases, it's appropriate for those students to have support with therapists or psychiatrists in the community who'd be able to provide them with continuity of care, which is really important because while we're here to support your student, it may not be clinically indicated to see them for 12 sessions and then transfer them over to someone. That can be pretty stressful. But again, we'd be happy to support you through that process if you need us to. And that handout will go out tomorrow. So that's it about CAPS, and now Ms. Deanie will discuss the Student Health Center services.
Good evening, and thank you for your patience while we switch chairs here. My name is Deanie Stoulig, and I'm one of the nurses at the Student Health Center. Our Student Health Center is a 3-story white and stone brick building, building number 92, and it is also just a 3-minute walk from this building. We're broadcasting from the LBC is what it's called, but it's really the student union pretty much in the center of campus. So we are on campus, and I'm going to take a minute to talk to you about what our team looks like in our building. So on those 3 floors, we have medical providers, include 4 physicians, 3 family nurse practitioners, 8 to 10 full-time nurses, and we also have a registered dietitian. All of these providers have multiple years of college health experience. Some student health centers across the nation have physicians that have outside practices and just kind of go to the student health center on occasion. That's not the way our staff is set up. Our providers simply work for us only. So on a daily basis, we have 4 physicians, 3 family nurse practitioners, and several nurses ready and willing to help your student. We do have board certified physicians. Some are board certified in internal medicine. adolescent medicine, pediatrics. Our providers have interest and experience in men's health, eating disorders, and transgender health. These are the services that we offer all in our building, building number 92. I mean, we'll talk a little bit about each one of them, but I do want to point out that our pharmacy does take outside insurance. So if your student has to fill their prescription, you want to make sure they have their insurance card with them. Now, we take most of the family network insurance, and there's no real way for us to know if we take your insurance until your student tries to fill a prescription and they quote unquote run their insurance. So there are other options in the city. There are several pharmacies that are in walking distance, 3 or 4 in fact, but they're in walking distance when your student is feeling well. So it's like maybe a 15-20 minute walk to the closest Walgreens, but not when you have 102 fever. So make sure that your student has their insurance information with them. So these are some of the nurses in our primary care clinic. So you can see we're well staffed to manage the chronic and acute illnesses that are common to young adults in college. Our clinic does function as an ambulatory care clinic. We're a by-appointment clinic that strives to schedule your student for same-day appointment if ill. So these are some of the things we do in primary care clinic. If your student is an asthmatic and his inhaler isn't quite doing what he needs, we do have several nebulizers, sometimes during cold and flu season. All 3 or 4 of them are going at once. We do IV fluid hydration for many issues. For if your student has a GI bug and he's dehydrated, or if your student just didn't hydrate in between those 12 beers when he was watching the baseball game last night. So we frequently do IV hydration in our rooms. We do wound management several times. We've taken care of your students with pilonidal cyst and burns and different issues like that. We put sutures and staples in, and we can take them out. We do have 2 providers that are certified in acne management with Accutane. So yes, we can have your student go online in their iPledge account and request the provider that we have at the Student Health Center to help continue their Accutane and their monthly labs. In our 3rd floor clinic, which is the Preventive Health Clinic, these are all of the different clinics that we offer. In our allergy clinic, we do not have an allergist on staff, but if your student is receiving allergy injections on a regular basis, they just bring their vials and their orders from their private allergist or ENT, and we match them with our protocols and continue to give your student their injections twice a week, once a month, whatever is required for your student. They do that by appointment, and on move-in day, we may not be able to see your student and give him or her allergy injection until we process paperwork, but we certainly can take those allergy vials off of your hands and keep them in our refrigerator. We have an immunization clinic. We offer all immunizations that are available. We have a nurse-run, physician-supervised travel clinic, and this means that we can take care of your student no matter what assignment they get. It never ceases to amaze me some of the opportunities that our students have going to Nairobi to catch rainwater to build cleaner drinking systems. So that is also by appointment because we do the education, the immunizations, and the prescriptions that they need for malaria or traveler's diarrhea. And we require the education because our feeling is that it's silly for me to give your student a hepatitis A vaccine and not teach them how to avoid hepatitis A. So the greater part of it is education on, protection from mosquito bites, food and water precautions. But we have a very active travel clinic and offer appointments during the week. Our two family nurse practitioners and a preventive health clinic have many years experience in women's health and college health, and two of our providers have been involved with men's health and trans health for several years now. We also own 2 ambulances, so our Tulane students, generally they're students who are pre-med, volunteer to be members of our Tulane Emergency Medical Services, or TEMS as we call them. So it is an on-site ambulance service. It's a dedicated group of volunteer students who are trained as EMTs. For instance, if your student comes in and our provider feels like they may be having an appendicitis, we'll call TEMS to bring your student to the emergency room. I've had students, about 2 or 3 years ago, a student came in and they've learned to use this as a verb. She told me, I was so sick last night that they almost TEMS'd me. I said, they almost did what? She said, they almost TEMS'd me. So it's a verb in their language. So they're well aware of the services. We encourage them to program the emergency number into their phone so they'll have it. They're on call 24/7 and can respond to your student's call at 2 a.m. if they are very acutely ill. So the bottom line is you want to know what to do when your student is sick. Our acute care management is available by appointment or really by walk-in all year long during the school year and during the summer. We are about to start with online scheduling with acute care appointments that open up at midnight. For instance, there'll be several appointments, quote unquote, regular appointments that are open all the time. So your student, if they're feeling a little sick today, but they're busy, they can go online and schedule an appointment for tomorrow. But if your student wakes up at 2 a.m. with a raging sore throat and a horrible fever, they should be able to go online and schedule an acute care appointment because those appointments will only open up and be available for scheduling after midnight. What we'll do is we'll open up the morning appointments after midnight and then open the afternoon acute care appointments after 2 o'clock. Yes, everybody wants to come in at 4 or 4:30, when they're finished classes, but that doesn't make much sense. We want to see them as early as possible when they're sick. So what we try to do by opening up the morning appointments at midnight is drive the students to the morning appointments so they can get in and get taken care of. We also have a student health phone triage. So we have one of our nurses that listens or picks up messages. Several of our nurses pick up messages during the day, and we can call your student back that day and help them decide whether they're ill enough to come in. Frequently when they call, I'll say, well, get a flashlight, go look in the mirror, and tell me what your throat looks like. And if it's pink and they don't have swollen tonsils, then I can recommend some good over-the-counter medicines. And warm saltwater gargles and Sebastatin lozenges and different things like that. If it's raging fire engine red, we'll give them an appointment to be seen today. One of the things that I would like your help, I have a job for you parents, is to please send your student to school with a small first aid kit. Something that contains a digital thermometer, and please teach them how to use it. Some Tylenol, ibuprofen, Band-Aids, antibiotic ointment, cough drops. You can even put the 12-hour cough medicine Delsum in there. But just anything that you think they might need if they're mildly ill. Your student knowing their temperature helps us know how to guide them. If your student calls my front desk and says, I had 102.4 fever last night, my receptionist knows exactly what to do. She will offer them an appointment. But if your student calls and says, I felt a little feverish last night, it's not giving us enough information to go on. So helping your student know their temperature is a huge help in getting them seen more efficiently. If they call or go online and they're acutely ill today and all the appointments are booked up, we still encourage them to come in. If it's a minor illness, the nurse has standing orders to order throat cultures and recommend over-the-counter medicines. If it's an acute illness and there's no appointments left, we'll figure it out. We'll figure out a way for a provider to see your student that day. That's what we do as nurses. After hours, when we're closed, and our open hours are from 8:30 to 5 p.m., Monday through Friday, and Saturday we have an acute care clinic from 9 to 1. We have less providers on Saturday, like maybe one provider and 2 nurses. So this is not for the time for your student to come in and discuss his acne management. But if he doesn't feel well or he twisted his ankle while he was in the French Quarter last night, we absolutely want to see them anytime between 9 and 1. We prefer seeing them early in case we have to refer them out to get an x-ray. Unfortunately, at this point in time, our student health center does not have radiology services, but we are hoping to build a new health center in the next 5 to 10 years where we'll be able to provide that. But anyway, our phone med nurse advice line is an outside company that we pay for after hours advice. So this is the 1-800 number that your student will call. That nurse is not located here. I believe they're located in Nova Scotia, but they are awake all night waiting for your student to call and discuss their care. So that phone nurse will tell them, see a physician in the next 24 hours, be on the step at the student health center when they open at 8:30, or go to urgent care or the emergency room now. The beauty of this is the next morning, Phone Med faxes us all of the calls that they have gotten with the symptoms, the phone number, and the advice that they gave, and we call your student to follow up to see if they followed the advice of the phone nurse, and if they didn't, how can we get you seen real quickly. Let's talk a little bit about private information. We are a HIPAA covered entity, so we are unable to share your students' private health information with you without their permission. But I just want to reassure you that that's the last thing you want to hear from me when you call when you're concerned about your student. I'm not going to say, well, I can't tell you anything. I don't need your student's permission to listen to you and listen to your concerns and discuss what's going on about your student and say, why don't you hang up and call your student and tell them to come in. I have an appointment at this time, or I don't have any appointments, but tell them to walk in so we can get that taken care of. So we can listen to your concerns and figure out a course of action. So these are some of the things that Maeghan talked about. The first thing is your immunization information should have been submitted. Today was the deadline, but have faith if you didn't send it in. We answered lots of phone calls and emails the last couple of days. The actual block on your student's registration doesn't go on till August 1. We just want to give us some wiggle room to get all those papers submitted and processed. So if you haven't sent your students' immunization information through the patient portal, there are instructions on our website on how to do that. It's very simple. You download the form, you enter the dates of the required immunizations, and you upload any information that you have. We'll take our form, we'll take your doctor's office form, if that's all you have. Anything that officially documents their immunization will take. One of the other things you have to do is look at your health insurance. I want to say that most of our undergraduates stay on their insurance, their parents' insurance plan, but that has to be your decision. Look at our policy that is offered. It's United Healthcare. That is the provider of our plan this year and last year and hopefully next year. And look at the benefits and the cost and then compare it to your insurance plan. You want to make sure that your student will be covered under your plan here in Louisiana. For instance, if you have a tri-state plan that covers Philadelphia, New York, and New Jersey, but doesn't cover Louisiana, you may want to look into our plan. So you want to make sure that your student is covered for both emergent and non-emergent issues in Louisiana. If they are, then all you need to do is enter your insurance information on that website and decline our policy. You have till August 31st to do that. The student also needs to complete their online education so that as we meet with them to share and help them through their college experiences, we know that they're all coming from the same baseline of education. We do have more parent webinars in August, and we encourage you to attend those. And we will be doing this exact same thing on move-in day at 2 o'clock in the afternoon. So we'd love to have you join us, or your spouse if they were unable to attend summer orientation or this webinar. Now, this is more information about the student's medical or health insurance. So every Tulane student is required to have health coverage. You've got to take some kind of action to either sign up or waive, or you will be automatically billed for the student health insurance plan. We call that SHIP. This is something that we need to discuss because it can be very confusing, but it's two separate things. There's a health and wellness fee that is automatically charged with your tuition. It's mandatory for undergraduates and all full-time students, and that provides office visits with physicians and nurse practitioners, counselors, and psychiatrists. It provides advice from our 24/7 nurse advice line. We have a referral coordinator that works only with us to help get your student appointments with outside physicians. It supports outreach and health education, all the events sponsored by the WELL, and it covers the cost and repair of our Tulane emergency medical services, our ambulances. So your student might have learned about free massage Monday and Thursday, where they're free chair massages. Well, they're not really free. You're paying for them with a mandatory fee. But we will be offering free flu shots at the Student Health Center 3 days a week in the entire month of October, and that's what this fee pays for also. If you subscribe to our student health insurance plan, all prescriptions will be $15 copay and all lab fees will be covered. However, you never, whether you do our insurance or not, because of the health and wellness fee, you never have to pay a physician visit fee. Your student can come see us every day if he wants. I don't encourage that, but they can. This is our website. It's very interactive. If you have any questions, we encourage you to go there because it will help you get through just about any questions that you have. Here are the 3 locations of the Student Health Center, the Well and Counseling and Psychological Services, and the Student Union is actually this little L-shaped green building called the LBC, sort of centrally located. So you can see that we are not very far away from the LBC and from one another. Here are numbers where you can contact us, and I am going to turn the program over to Penny.
Okay, parents, we've had a really comprehensive presentation, but I know that some of you still may have questions. So we're going to start the Q&A now. We'll go until 8 o'clock. We'll close things down at that point. But if you have further questions, then we will try to answer those, and we'll add that information to the email that I will send you tomorrow with these slides. So I'm going to read the questions, and then one of our presenters will answer. So, just a second. So there's one question about homesickness and how that'll be monitored on Tulane's end, and that since our family weekend is scheduled so late in the semester, since it's the first weekend of November, I think just a question about that. So I think that's one of those things that we've got a lot of people kind of tuned in to paying attention to first students' needs. And so RAs, residence hall floors, those student staff members, are probably the first people to notice something like that. And they're backed up by their supervisors, who are all master's degree holding professionals who live in the residence halls too, to help them kind of sort through issues. They've got somebody they can run something by, say, I have a student who seems really down, seems to need some more help, and they'll kind of work together to help get them a referral to CAPS perhaps if they need that, or just kind of check in, or help get those students kind of connected to other people, or just give them somebody to talk to kind of acknowledge that they may be homesick and kind of find out they're probably not the only person who's ever been homesick, but they can feel that way at the beginning of the year. I think the things for parents to remember is that if you are ever concerned about your student, then to get in touch with one of us and one of the contact numbers that you'll see, and we can reach out to students. So we can do that sometimes very discreetly and have the RA kind of check on them, or we can be a little bit more direct about that if you feel like that's what's needed. But I think we've got a lot of people between the orientation counselors, the orientation coordinators serving your students in the first couple of weeks and meeting them all the time and going to events with them, to the RAs living on their floor with them all year long, and the fact that all first students are in a TIES class where professors kind of know that their students could be dealing with some of these things. There are a lot of people tuned into freshman needs. So another question is, what is the website to enter the private insurance information and opt out of the student health plan?
You can go on to the Student Health Center website, and there's a list of links on the right-hand side, and one of them is insurance. So it's pretty easy to find.
So if you have any further questions, then go ahead and write those in. Looks like we're waiting for a couple more questions. So one of the questions is, the well seems to focus on alcohol risks. What about marijuana or other drugs perhaps?
So the well can also focus on marijuana. However, what we know from our data is the top issue for our students is alcohol. So that's why the alcohol is a primary focus. But basics, brief alcohol screening and intervention for college students can also address marijuana. So what happens is we use, the program looks the same, except we're talking about a different substance, marijuana.
Okay. So any other questions, parents? I know that somebody asked in advance about the smoking cessation, and I know you mentioned that you have that that kind of education. Could you say a little bit more specific
If
about
your
it?
student is interested in tobacco cessation, all they have to do is go on to the WELS website and they'll find the tobacco cessation link and they can register online. Once they register online, then a health educator will contact them and set up an individual appointment with them. And this program is catered to each student's needs. There is no like number of sessions. It's just based off of where the student is in their process, and then the student will meet with the health educator for the first session about 45 minutes, and then each session thereafter, it's typically a check-in from 15 to 30 minutes. And then as well, which is also included in the Student Health Center wellness fee, is tobacco cessation nicotine replacement therapy. So if it happens to be part of your student's quit process to either need the patch or the gum, your student will be provided with that as well if it's part of their plan.
Okay, so the next question is that I have all the medical forms completed as well as printed record, the immunizations. Can I take a photo of this and upload the JPEG to the Health Center website, or does it have to be scanned PDF?
Well, it's pretty easy to upload into our patient portal system. And your student should know how to do that very easily if they're in town. If not, you can, if it's not working for you, or you can scan it and email it to us, to the immunization network, but it's pretty easy to do on the patient portal.
So I think it's probably just an issue of whether they have a scanner available or a phone.
They could paste a picture on a...
Yeah, you can. What
would you say? You could probably ask them like a FedEx or something.
Here's one suggestion. I know that we used a registration form that had both options. So I don't know, Dee, would it be any problem? They tried to upload it as a JPEG picture first, and then if that didn't work, they could just scan it and do that later. Mm-hmm. So I think you should at least try with the JPEG, and we might check this out tomorrow morning and get the final answer for that. And then when I send you the email, I could let you know what the options are, and if it'll take just one of those or both. So we'll include the answer to that question in the email that you'll get tomorrow afternoon. So the other question is, there a laminated form with all the numbers and information for wellness? So there is a lot of marketing that these departments do. I'm not sure if there's any one card right now, but I know that what we do a lot with the students at the beginning of the year with RAs and the OCs is really tell them to take their phones out and program these numbers in now. So that's another thing you just may want to do with your student as you're talking about their preparation for coming to the university in August. When you get the slides for the presentation, then just kind of walk through those and maybe just sit there and make sure they've already programmed them into their phone. There's a lot of information posted, everything on the website. Our students go to the website for most everything, and they can access that usually from the phone as well as their computer in their room. So, but if you want to just be really sure, I would say sit down with them and program those numbers in. So another question is, my son has developed food allergies to fructose, gluten, lactose, and some things like that in the last few months. How could you help him? I'm worried about food availability for him. Can you speak to that?
Yes, we have a great program. It's called Special Chef, and we have refrigerators set aside and microwaves and separate from the regular ones, so your student can set up an appointment with a chef and actually pick out the foods that he likes, and can plan a menu, and the chef will prepare your food, prepare your student's food, put his name on it, and put it in that special refrigerator. So I suggest that you get in touch with Lisa Norris or
Dining Services,
and
Jackie Rouge.
Jackie Rouge in Dining Services.
We'll find that number for you to give you, and the email address as well. But they definitely have some. They can customize so much that you would be surprised. And they make a real effort to do that for students who have those kind of allergies and food restrictions. So the next question is, can you speak more about sexual assault prevention programs that are in place or being developed now?
So as I mentioned, we do have a bystander intervention program in place on campus, and we do refer to that as One Way. And we have trained many students and staff members with One Wave. So we have that. We also have a sexual violence prevention and education coalition, which is made up of many different campus stakeholders. And this coalition drives the work that we do on campus in regards to sexual assault prevention. And so this coalition is very active. We are in the midst of planning for the fall, so we'll have many events, outreach, educational opportunities for sexual assault prevention on our campus. We also have the Office of Case Management and Victim Services.
Yes.
Which is also available for our students to access. And also our counseling center is well equipped for response and intervention.
And we will also, and it's addressed in the My Student Body?
Yes, My Student Body not only speaks to alcohol, but also sexual assault prevention, bystander intervention.
For the first time this year, we're also going to offer a webinar on that topic, and I apologize, I don't have that date at my fingertips. I think it is in early September, so that parents can learn more about how we are handling that kind of education and support and services. So if you go back to the webinar list at parents.tulane.edu, then you could sign up for that one too, and we'll have those people who are actually doing those programs all the time and working with those issues give you some more information about how we're addressing this, and also be there to answer your questions. So I do have that phone number for the dining services office. It's 504-865-5712. So again, that's 504-865-5712. And their email address or their website is just diningservices.tulane.edu. And you can look there for more information about the people who can help with the dietary restrictions and allergies. So the next question is, you said that Tulane is bound by HIPAA, but is there a protocol for notifying parents in case of a student health emergency?
If there's a student in crisis, we usually, while the student is sitting in our office, say something like, maybe it's time to get your parents involved here, and the provider and the student will call the parent together while they're there. Frequently, if it's a medical emergency, and I find that we frequently take the student's cell phone from them to give an update to parents while they're in the student health center. And it's one of the last things I say to the student as they're being carted off in the stretcher to go to the emergency room. You've talked to your parents, haven't you? So, yes, we will notify you, or if your student has not been touched, we'll make sure that happens if they are in crisis.
So the next question is, if a student is prescribed Adderall for ADD, but we're concerned about having him share this medication with friends, can we have someone in the student health center give him weekly amounts?
No, unfortunately, we don't have a program like that. And you'll just have to explain or just have a good conversation with your student about how this drug is frequently abused, and he needs to keep it not out in the open, keep it tucked away, locked away in a small suitcase in his closet if need be. But no, we don't give medicines to students. And he just has to understand how important it is that no one should take any medication, antibiotics, any depressants, anything that is not prescribed for them.
Okay, so the next question is, does the immunization record need to be signed by the pediatrician or physician?
If you're taking your student to the pediatrician, then yeah, you can fill that form out and have the pediatrician stamp and sign it. But if you have, or if the physician's office has an official record of their immunizations, the student just needs to fill out the top portion, the demographic portion of our form, and then answer the TB screening questionnaire on the top of page 2 and upload those, and you can upload the physician's office form also. We take that, absolutely.
So the next question is, where are the United Healthcare Student Health Insurance Plan policy options, policy coverage details, and the deductibles and that thing? Where is that located so that I can compare my family plan to that one?
It's, again, on the Student Health Center website. On the right-hand column, there's lots of A to Z services and lots of things, but one of the bullets under there is insurance. And if you don't get your questions answered there, we have 2 insurance benefits people. You can call the Student Health Center and listen to the prompts, and there is one for insurance questions, and they'll be very happy to help you.
Okay, so we're nearing the end of the hour, so we're going to just take a couple of these last questions that we have. And so the next one is there a buddy system for any wellness issues? So I know that we have a buddy system that's like pairing people, but some of those groups, support groups that were mentioned might be an option for some issues.
Definitely. We're trying to really create a community of care on campus. So through all the different programming that the Well does and the outreach that the Counseling Center does, just teaching students what to look out for, learning ways to support each other. So definitely the groups that we have at CAPS are a great option. We've had a lot of students come in for a consultation just to ask, what can I do for a friend who's experiencing X, Y, and Z, and we work with them to address that. So it's and incognito as well, incognito training.
Which is the online training mentioned when we mentioned My Student Body. And so while we don't necessarily have a buddy system, we are constantly working with your students on how to be connected and to connect. And there's multiple ways for your student to become connected. And a lot of that happens within the first few weeks that they're here. So encourage them to go to the expo, student organization expo, go to all the different activities so that way they can meet plenty of people and know all the resources available to them.
And I think that if we didn't quite answer that question, because I think we weren't quite sure what the parent might have meant by a buddy system, then please email one of the staff when you get this information tomorrow, if you need to clarify that. So we'll have just 2 more questions. Where will I find a release of medical information form if my daughter is willing to share such information? And so it's not really a specific form, right?
It is a specific form, and we just revamped our website, and it used to be under release of information forms, but since we just updated our website a month ago, I've not gone to find it, but it should be there. If it's not, just, use the numbers on the website to call us at 504-865-5255, and you can call, you can just press 4. That gets you to primary care where we are, and we'll be happy to work with you and look for it, and if all else fails, will give me your email address and I'll attach one and send it to you.
So here's the last question. It's, what if my daughter forgets to respond to the insurance questionnaire and health insurance is added for her? Can she cancel the plan if she provides proof of insurance? So I think this is one of those important deadlines that you want to talk with your student about to make sure that they respond to this, because they would be automatically enrolled and there would be no canceling, because it would suffice for that whole year, right?
Right.
And so if they
even do it with her, as I explained to parents at orientation, make this one of their first steps toward independence. Sit with them at the computer and enter their immunization dates and upload their forms. Sit with them with your insurance card at the computer, enter the insurance information, and decline our offered insurance. It's a great opportunity to show them how to take care of some of these very important things.
And then at the same time, make sure they have a copy of that insurance card if they're going to stay on your insurance, and that they have it in their wallet. And you might, I think it would even be smart to have an extra copy of that you keep somewhere, like on their phone. Take a photo of it and keep it on their phone, just so that they've always got access to that. So we're going to wrap up now, and I'll just remind you that I'll send you an email tomorrow or Friday with the slides from the presentation, and we'll include a couple of those answers to the couple of questions that came up tonight. So thank you for joining us. As I mentioned, please feel free to email us at parents@tulane.edu. Let us know if you found this helpful. If you have another topic that you'd want to address, or if there were some issues that we needed to cover differently. So it's really helpful to get that feedback. And so I see a few of you thanking us right now and saying great job, or this was helpful. And we love seeing that. Since we can't see you and see your faces, it's nice to get these little comments. So we're yeah, somebody from El Paso said thank you. So anyway, you've made our night, so thanks a lot. So tune in for the next webinar. Go back to our webinar list on parents.tulane.edu and sign up for some of the other ones. So thank you so much.